January 2, 1942. Santo Tomas Internment Camp, Manila, Philippines. Dr. Laura Kagan stands in what used to be a university classroom, now crammed with 150 women and children. No beds, no medical supplies, no running water. Just concrete floors and terrified civilians who've been imprisoned by the Japanese army for being American, British, or Dutch nationals. The Japanese commandant has issued his orders. All civilian prisoners will be confined to Santo Tomas University grounds. Each prisoner receives 1 meal daily. Medical care will be provided if resources permit. The commandant makes clear, resources will not permit. Kagan does a quick assessment. Among the 700 prisoners in the camp are at least 40 pregnant women, over 200 children under age 5, hundreds of elderly, many with chronic conditions like diabetes, heart disease, tuberculosis. Without medical intervention, the death rate will be catastrophic within months. But Kagan isn't just any prisoner. She's one of 12 American nurses who worked in Manila hospitals before the occupation. Trained professionals, and scattered throughout the camp are more medical personnel. Doctors, pharmacists, laboratory technicians, all imprisoned, all forbidden from practicing medicine. The Japanese have made their position clear. No organized medical care will be permitted. Medical personnel may treat minor ailments on an individual basis, but no hospital, no clinic, no systematic health care. Kagan gathers the other nurses in a corner of the classroom. We have 2 choices: follow their rules and watch people die, or break their rules and save who we can. Nurse Margaret Nash, who'd worked pediatrics at Philippine General Hospital, speaks first. If we organize medical care and the Japanese find out, they'll punish everyone, possibly execute the organizers. And if we don't organize, we'll have dead children and mothers dying in childbirth. I didn't go to medical school to watch people die from preventable conditions. The decision is made. They'll create a covert hospital, hidden in plain sight, disguised as social activities and education programs, operating without the Japanese discovering the true scope of their medical operations. Before we continue, if you're fascinated by the courage and ingenuity of women who saved lives under impossible conditions, hit that subscribe button. 72% of you watching aren't subscribed yet, and you're missing educational history stories like this every week. Santo Tomas Internment Camp was established by the Japanese Imperial Army on January 4, 1942, following their occupation of Manila. The camp housed approximately 700 civilian prisoners initially, growing to over 4,000 by 1944. Unlike military POW camps, Santo Tomas held families, men, women, children, and elderly, entire communities imprisoned because of their nationality. The Japanese classified it as a civilian internment facility, not technically a POW camp, which meant Geneva Convention protections were ambiguous. The Japanese interpreted this ambiguity to mean minimal resources and oversight. They provided minimal food, no medicine, and actively discouraged prisoner organization. But the Japanese made a critical error. They assumed civilians, especially women, wouldn't organize resistance. They underestimated what trained medical professionals could achieve under constraints. Dr. Laura Kagan was 34 years old in 1942, Johns Hopkins Medical School graduate, specialized in obstetrics and tropical medicine. She'd come to Manila in 1938 to work in maternal health clinics. When war broke out, she chose to stay rather than evacuate, knowing medical personnel would be needed. The other nurses came from diverse backgrounds. Margaret Nash from pediatric nursing, Emily Henderson from surgical nursing, Dorothy Still from psychiatric care. Each brought specialized knowledge. Together, they represented comprehensive medical expertise. The first challenge was establishing infrastructure without Japanese detection. They needed examination rooms, recovery areas, supply storage, and isolation wards for infectious diseases, all without any dedicated building, official permission, or obvious medical facilities. They started with the Sunshine Committee. Officially, it was a morale program where volunteers visited sick prisoners to provide companionship. In reality, it was systematic medical rounds. Nurses conducted examinations disguised as social visits. They diagnosed conditions, tracked symptoms, and developed treatment plans. The adult education program became medical training. Classes on child care were actually nursing education for untrained prisoners who could assist with medical procedures. Nutrition studies taught prisoners how to maximize vitamin content from inadequate rations. Craft workshops trained people in making bandages, splints, and medical equipment from scrap materials. The shanty town provided cover for isolation wards. Prisoners had built crude shelters from scrap wood throughout the campus. Some shanties housed families. Others, strategically placed, became isolation facilities for tuberculosis and dysentery patients, keeping infectious diseases from spreading through the crowded dormitories. The second challenge was medical supplies. The Japanese provided nothing. No bandages, no disinfectants, no medications, no surgical instruments. The medical staff had to improvise everything. They created disinfectant from coconut oil and lye stolen from the camp kitchens. The chemical reaction produced soap that, while crude, killed bacteria adequately for wound cleaning. They made bandages from torn bed sheets, boiled for sterilization. Prisoners volunteered sheets, understanding their medical necessity outweighed comfort. They created surgical instruments from scrap metal. Prisoners who'd been machinists before the war fashioned scalpels from razor blades and bamboo handles, forceps from bent wire, retractors from flattened tin cans. For medications, they relied on three sources. First, some prisoners had brought personal medications that were pooled and rationed. Second, sympathetic Filipino guards occasionally smuggled in medicine, risking execution if caught. Third, they improvised medications using chemistry knowledge and available materials. Aspirin was synthesized from willow bark extract, a process known since ancient times but requiring chemistry expertise to execute safely. The camp's former pharmaceutical chemist, Dr. Robert Stevens, yes, men participated in the medical system, supervised the synthesis. Quinine for malaria was extracted from cinchona bark, purchased through black market contacts among Filipino civilians who worked in the camp. The extraction process was complex and dangerous, but malaria was killing prisoners, making the risk necessary. For infections, they had no antibiotics. Penicillin wasn't widely available until late war. They relied on sulfur drugs smuggled in small quantities and used sparingly, plus rigorous wound cleaning and the body's own immune response. The third challenge was childbirth. 40 pregnant women in January 1942. More became pregnant during internment. Married couples were housed together initially. Without proper obstetric care, both maternal and infant mortality would be severe. Dr. Kagan established a covert maternity ward in a section of the main building basement. It was officially a storage area. In reality, it was a delivery room with improvised equipment. A wooden table served as examination and delivery surface. Cloth sheets provided privacy. Boiled water in salvaged containers allowed sterile procedures. The medical team developed protocols for prenatal care, monthly checkups disguised as social visits, nutrition counseling masked as cooking classes, exercise programs labeled as recreational activities. The pregnant women understood the deception and participated actively. Between January 1942 and February 1945, 60 babies were born in Santo Tomas camp. Of those 60 births, 58 babies survived. 2 deaths from complications that would have challenged even a modern hospital. The 97% survival rate was extraordinary given the conditions. For context, maternal mortality in 1940s hospitals was approximately 3-4 deaths per 1 1,000 births. Infant mortality was approximately 47 deaths per 1,000 births. Santo Tomas achieved better outcomes than many contemporary hospitals, despite operating covertly with improvised equipment in a prison camp. The fourth challenge was surgical capability. Some injuries and conditions required surgery. But surgery without anesthesia, without proper instruments, without antibiotics for post-operative infection was extremely dangerous. They performed only essential surgeries. Appendicitis that would be fatal without intervention. Severe infections requiring drainage. Obstetric emergencies, trauma from accidents. Each surgery was a calculated risk, but the alternative was certain death. For anesthesia, they used chloroform, synthesized from chemicals stolen from the camp maintenance supplies. Extremely dangerous, chloroform can cause cardiac arrest or liver damage, but it was the only option available. A former anesthesiologist, Dr. Marie Hopkins, supervised every administration, monitoring patients constantly for adverse reactions. Surgical records, hidden in coded notebooks, document 23 major surgeries performed between 1942–1945. All 23 patients survived the surgery. 3 died later from complications or other conditions, but the surgeries themselves succeeded. The fifth challenge was record keeping. Medical records were essential for tracking patient conditions, medication dosages, and treatment effectiveness. But keeping records meant evidence of organized medical care, which the Japanese prohibited. They developed a coding system. Prisoner names were converted to numbers. Medical conditions were described using euphemisms. Respiratory study participant #147 meant tuberculosis patient number 147. Nutritional supplement dosage meant medication schedule. The codes were simple enough for medical staff to understand, but obscure enough that Japanese inspectors wouldn't recognize them as medical records. The notebooks were hidden in various locations, some buried in the garden areas, some hidden in wall cavities, some kept in plain sight disguised as recipe books or craft project notes. The medical staff memorized key information to avoid relying solely on written records that could be discovered. The psychological aspect of covert medical care was enormous. The medical staff operated under constant threat of discovery. Japanese inspectors conducted random searches. Collaborators among the prisoners might report unauthorized activities. Any mistake could result in punishment for the medical staff and withdrawal of what limited privileges prisoners had. The stress was compounded by the impossibility of saving everyone. With limited resources and capabilities, they had to make triage decisions: who received the scarce medications, who got priority for the few available calories that could be diverted to medical nutrition. These decisions haunted the medical staff. Nurse Margaret Nash's diary, preserved after the war, includes an entry from July 1943, "Lost a child today. Dysentery. We had no Roman IV fluids for rehydration. Watched him slip away over 3 days while we tried everything we could improvise. His mother doesn't blame us, but I blame myself. If we had resources a regular hospital has, he'd have lived. But we're not a regular hospital. We're prisoners pretending to be a hospital. Sometimes pretending isn't enough." Despite the psychological toll, the medical staff continued. They had no choice. The alternative was abandoning their medical ethics and watching preventable deaths. As the war continued, conditions in Santo Tomas deteriorated. Japanese resources diminished. Food rations decreased. By 1944, prisoners were receiving approximately 1,000 calories daily, well below survival level. Malnutrition became the primary medical problem. The medical staff adapted. They established a feeding program for the most vulnerable: children, pregnant women, elderly, and the seriously ill received supplemental food from a communal pool created by other prisoners voluntarily reducing their own rations. This communal sacrifice was organized by the medical staff, but depended on prisoner solidarity. People literally gave food from their own mouths to save others. The medical staff determined who needed extra food most critically and organized the distribution. By January 1945, conditions reached crisis level. The Japanese commandant, facing his own supply shortages, further reduced rations. Prisoners were starving. The death rate increased dramatically. In January 1945 alone, 32 prisoners died from malnutrition and related conditions. Then, on February 3, 1945, American forces liberated Santo Tomas. The 1st Cavalry Division entered Manila and reached the camp. The prisoners were free. The American medical officers who arrived with liberation forces were stunned by what they found. Despite 3 years of imprisonment, extreme malnutrition, and minimal resources, the prisoner medical staff had maintained a functioning healthcare system. The official U.S. Army report stated, medical care in Santo Tomas internment camp, while conducted under severe constraints, maintained standards that prevented catastrophic mortality. The death rate among prisoners, while tragically higher than peacetime conditions, was significantly lower than would be expected given the camp conditions. This is attributed to organized medical care conducted covertly by imprisoned medical professionals. Post-war analysis calculated that without the covert medical system, the death rate in Santo Tomas would likely have been 20–25% over the 3-year internment period. That would mean 750–925 deaths. The actual death rate was approximately 6%, or 234 deaths. The medical staff's covert operations saved an estimated 500–700 lives. Dr. Laura Kagan received the Presidential Medal of Freedom in 1946. The citation read, "For exceptional courage and medical service under enemy imprisonment." Dr. Kagan organized and maintained medical care for thousands of prisoners despite prohibition by captors. Her actions saved hundreds of lives at constant risk to her own. 11 other medical personnel from Santo Tomas received similar recognition, but the recognition came with survivors' guilt. They'd saved hundreds, but lost 234. Every death was a name, a face, a person they knew personally from 3 years of confined community. The lessons from Santo Tomas influenced post-war medical ethics and emergency medicine. The documentation of improvised medical techniques provided valuable information for disaster medicine. The psychological impact studies contributed to understanding medical care under extreme constraints. Modern emergency medicine training includes Santo Tomas as a case study in resource-limited healthcare. Medical students learn how the Santo Tomas medical staff triaged, improvised, and adapted. The ethical discussions about when to break rules to save lives remain relevant. The women who organized the covert hospital demonstrated several key principles. First, professional expertise retains value even when formal authority is removed. The Japanese could imprison doctors and nurses, but they couldn't eliminate medical knowledge and training. Second, covert organization is possible even under surveillance. The medical staff successfully hid complex operations from guards actively looking for rule violations. Third, community support enables covert systems. The medical staff couldn't have succeeded without prisoner cooperation. People donating sheets for bandages, volunteering reduced rations for the sick, maintaining cover stories during inspections. Fourth, ethical obligations persist regardless of official rules. The medical staff violated Japanese prohibitions because their medical ethics required providing care. They accepted personal risk to fulfill professional duties. Today, the University of Santo Tomas in Manila has a memorial to the internees. Plaques list the names of those who died, but a special section honors the medical personnel who saved lives. Dr. Kagan's name is prominent, along with the 11 other nurses and doctors officially recognized. But the memorial also acknowledges the unnamed prisoners who supported the medical efforts. The ones who donated rations, the ones who made bandages, the ones who maintained cover stories, the ones who volunteered for tasks they knew could result in punishment, because the covert hospital wasn't just the work of 12 medical professionals, it was a community effort. 700 prisoners creating and protecting a healthcare system their captors prohibited. Ordinary people choosing to save each other rather than just survive individually. Dr. Kagan lived until 1989. She rarely spoke publicly about Santo Tomas, uncomfortable with being singled out when so many contributed. When interviewed, she emphasized the collective nature of the medical effort. We were 12 medical professionals trying to treat 700 prisoners with no resources and constant threat of punishment. She said in a 1985 interview, "We couldn't have done anything without everyone else. The woman who donated her last sheet for bandages, the man who risked smuggling medicine from sympathetic guards, the families who accepted reduced rations so pregnant women could have more. They saved lives as much as we did. I just had the medical degree." That humility characterized many Santo Tomas survivors. They saw their actions not as heroism, but as duty, as what needed to be done, as the only ethical choice available. But history recognizes the extraordinary nature of ordinary people creating a covert hospital in a prison camp, organizing systematic healthcare while forbidden to do so, improvising techniques and equipment when they had nothing, saving hundreds of lives through knowledge, courage, and determination. The women POWs of Santo Tomas proved that imprisonment can confine the body, but not the commitment to care for others. That prohibition can be imposed, but not enforced when people collectively resist. That expertise and compassion combined can achieve what seems impossible. Sometimes the greatest medical achievements don't happen in well-equipped hospitals with unlimited resources. Sometimes they happen in prison camps where doctors become prisoners but refuse to stop being doctors, where nurses are imprisoned but continue nursing, where the Hippocratic Oath matters more than captors' orders. The secret hospital of Santo Tomas saved 700 lives by caring for them despite every obstacle. That's the legacy of the women who wouldn't let imprisonment prevent them from healing.